Hello sir, thank you so much for being here. Sir, could you share a little about your background and experience in medical field and education?
Yes. Okay, my name is Professor Viktor Vasilievich. I'm a professor in the Department of the Surgical Academic Subjects, and I graduated Vladivostok Medical University in 1982. Okay, so and at 1984 I graduated residentship as a doctor, surgeon, and from this time I'm working as a doctor. Since this time I'm working as a teacher, and so my experience as a doctor and a teacher approximately 42 years. 42 years. Okay, so I work as a professor in the FEFU University since 2011, and I teach the surgical academical subjects. For example, general surgery, faculty surgery, hospital surgery, transfusiology. I started this teaching from 2014. I organized a Russian educational program. Since 2016, I organized the international educational program General Medicine, and now from that time I am the head of the both educational program Russian and the international medical program General Medicine and Лечебное дело. Okay, so now I'm a surgeon who treat patients as a surgeon, and I can share my experience and my knowledge to students.
Thank you so much, sir. Sir, would you be able to give us an overview about the medicine program at FEFU, like an overview, its structure, and its philosophy, how it works here?
Okay, so in our School of Medicine, we have two educational programs, Лечебное дело in Russian language and General Medicine in English language. And so this both educational programs are realized according to the federal state educational standards, and they are equal, and the all knowledge which students can have on the Russian program and the English spoken program are the same, without any difference. Okay, so and I need to explain to you that all students can have all knowledge which you need to have to be a successful doctors. The term of education there is 6 years, and according to the federal education standard, during time of education, students can learn the academic disciplines on the fundamental sciences, clinical sciences, and not only academic sciences and practical trainings during all 6 years. Okay, so our education program is specialty, not baccalaureate and the magistrate. Okay, so and after the graduation of this education program, all students will have the grade specialist. Okay, so after the graduation, all students must have the primary professional accreditation, and after this accreditation, they can have possibility to work as a specialist doctor, general practitioner, to elevate to improve this qualification, their qualification, our students can enter to the residentship for different specialties. For example, therapeutics, surgeon, dermatology, oncologist, obstetrician, neurosurgeon, infections, and others. And after the residentship, our students can have any medical specialty, because we know the 72 medical specialists, and so our diploma, our education can give this possibility to be the different specialists, but only the graduation, the residentship. Okay, so and consider our education and all skills that our students can have, can give them be successful and can realize the potential in their life.
Thank you so much, sir. How is the curriculum organized across the years of study here in TOEFL?
Okay, thank you for the question. Traditionally, all academic subjects we distinguish as fundamental and the clinical. And the first two courses, our students study the basic fundamental academic subjects, and on the first course, our students have the academic subjects, sometimes basic nursing, for basic skills for nursing of the patient. And this academic class, the students have in the simulation centers, and can have the skills for nursing patient. And studying the third course, we'll start the clinical academic subjects, when examination patient, learning the different diseases and understanding how to examine patient, take diagnosis and administrate the treatment. And so, and our academic class are conducted in School of Medicine, in the medical complex of the Federal University and the most important hospitals of Hydrocarbons.
Yes, sir. Thank you, sir. Is the medicine program delivered fully in English, or there is any kind of a transition during this period? So at what point during the 6 years do students start their clinical rotations?
Okay, we know that clinical practice, clinical training, that is very important, and our students start this clinical training from the first course. And we have two types of practice on the first course. It is educational practice on the simulation center, and taking skills for examination of the patient. After the first course, our students have practice as medical staff in the hospitals. And after each course, our students have practical training. And during 6 years, our students have seven practical trainings. And during this practical trainings, our students can have enough skills which will need in their practice.
Thank you, sir. Which hospitals and clinical places are affiliated with FEFU for clinical practices for the students?
Okay, so as I told earlier, our students have practice and practical classes in medical complex Federal University and in the main hospitals of the Vladivostok. And we know different hospitals. Okay, so and there are enough amount of the patients and the equipment and really qualified specialists. And on this clinical basis, our students can have enough skills and knowledge.
How does the program incorporate medical ethics so that the students how does the program incorporate students ethically so that students practice their duty responsibly?
Okay, thank you. We understand that ethic relationship between the patients, their relatives and the medical staff is one of the important part of the medical specialty, medical work. And in our curriculum we have some subjects, for example, history of medicine, bioethics, deontology, and on these academic subjects we teach the basic principles relationship between the medical staff and between the patients. Okay, so and the ethic questions we train in the clinical academic subject when the inspection examination of the patient because it is a very important part. And during our examination, during our studying on the clinical basis, when the contact with the patients, our students can have possibility to realize knowledge about the ethic, bioethic, and about deontology, and we consider that when the graduation they will be prepared to
be responsible.
Okay, so implement the knowledge in these ethic questions in their medical activity.
Are there opportunities of research and or co-curricular activities during their 6 years of study?
Mm-hmm. Okay, so we understand that learning the academic subjects, that is very important, but not this activity of the student is very important, but in other times our students may have many activities which are interesting for them, because they can have possibility to improve the skills in the surgical circle and not only manipulations, surgical manipulations. So our students can have to start their activity in the scientific researches. Okay, so because some students consider that they may be they can have realized them in the other fields, activity, therefore maybe sing, maybe dance, maybe sport. Okay, so the different types of activities, maybe not only the academic education and the other our students can have to. Okay, so I need to explain that. and our students regularly have participation in the Avira, the culture of India. That's very regularly.
Sir, I saw you were there. You enjoy it?
Yes, very well.
From your observations, how do Indian students find the academic and the social environment here in FEFU?
Okay, so we understand that it is very difficult for Indian students be far from the motherland, but Russia and the Federal University and the medical school are very friendly for our Indian students.
Yes.
Because we consider that our main aim it is the success of our graduates, and we help our students. We understand Indian students can have any problems, not only climate, maybe language, and the communication sometimes maybe. And our teachers and me too, help them always. Okay, so I explained once more that we do all for our students, for their success and for building their life as a professional activity.
What advice you will give to the students who are considering FEFU as their key option to pursue their medical career?
Okay, thank you for your questions. I want to tell you that the School of Medicine of the Life Science, Zurich is one of the best education organizations, and we can give the high quality education, medical education. I explained once more that our school is very friendly for our students and our teachers, our professors have high level of English language, and this can give our Indian students the possibility to study medicine on the level which approximately some more light than in other educational organizations. Okay, so and our curriculum is organized to have to give the enough amount of the education skills for our students. Okay, and so because we know our education can give possibility to realize their potential in different specialties and in the different countries too, because we know that our graduates had the accreditation in the different countries. In the Europe, the United Kingdom, German, Austria, French, United States of America. Okay, so and there are the doctors now, and we consider that can tell about the high level of our education, and if our students will study according to our requirements, they can have enough level what can give them the good basis for their successful medical professional activity.
Thank you, sir. हम आपका इंतजार कर रहे हैं।